How does one classify diabetes mellitus? Basically, there are three broad categories which can put diabetes into. Type 1 diabetes is seen in children, which is an absolute lack of insulin production because of various reasons. Insulin is not produced in the body, and children who suffer from this particular ailment are called type 1 diabetics. Type 2 diabetics is more common, seen in adulthood, where there is inappropriate insulin usage, and this is about 90% of the population compared to 10% of the population who develop type 1 diabetes. There is also another group of people who develop diabetes when the woman is pregnant. This is called gestational diabetes. This is seen typically by about the third trimester of pregnancy, around the 24th week or so, and if untreated can lead to various complications during delivery and after delivery. Let me talk about type 1 diabetes. Type 1 diabetes is otherwise called insulin dependent diabetes mellitus, otherwise called juvenile diabetes or childhood onset diabetes. Like I said earlier, absolute lack of insulin production leads to diabetes in this particular patient population. Fortunately, there is only 10% of the diabetics who are type 1, and they are usually seen in children. And this is a major diabetic subgroup in children, and unfortunately, this is an inherited disorder and cannot be prevented. Let me talk about the most common type of diabetes, which is called type 2 diabetes. This is called non-insulin dependent diabetes, otherwise called adult onset diabetes, and 90% of all diabetics are type 2 in nature. Insulin is produced, no doubt, but either it is inadequate or it is ineffective in terms of metabolism, and therefore this particular insulin glucose ratio being deranged, a person is prone to develop diabetes. They can be without symptoms, like I said earlier, for a long period of time, and by the time they develop symptoms, they may have various target organ damage, and sometimes many of these people present with symptoms only when the target organs are damaged. This can be to a certain extent prevented and controlled by adopting certain lifestyle changes, which I will talk to a little later. The third type of diabetes I was talking about is what is called gestational diabetes mellitus. This is the type of diabetes which is seen in the second and the third trimester of pregnancy. GDM or gestational diabetes mellitus tends to arise typically around the 24th week of pregnancy, and therefore every pregnant mother is advised to undergo diabetic screening at all stages of pregnancy, and if untreated they may have very adverse pregnancy outcomes. High blood pressure can be associated in these kind of people, leading to eclampsia and preeclampsia, and normal birth in these particular mothers can be difficult because of various metabolic problems, and the birth passage may be difficult, so they may be we may resort to premature delivery by way of cesarean section and so on. And a person who has gestational diabetes, even if adequately controlled, has to be careful even after delivery has been done, because they have a chance of developing diabetes in their later parts of their life. Like I said earlier, the children born out of gestational diabetes mothers also have relatively high risk of developing diabetes in their adulthood. Sometimes diabetes is caused by other disorders. This is called secondary diabetes. So even though a person has all the parameters normal, because a person is suffering from various disorders, a manifestation of this disorder can be diabetes. For example, there is a condition called acromegaly in the brain, where the pituitary is non-functional or dysfunctional, and this can contribute to diabetes. There is another condition called Cushing syndrome, which is a disorder of the kidneys, which can manifest as diabetes. Thyroid disorders like thyrotoxicosis can present as diabetes. There is a condition called pheochromocytoma, which is a disorder of the adrenal gland, which can promote diabetes. Chronic pancreatitis, that is inflammation of the pancreas, can manifest as diabetes. Some of the cancer patients can also develop diabetes as part of their particular disease manifestation, and certain drugs cause hyperglycemia and diabetes, and we have to watch out for all these conditions. Fortunately, these are all treatable. Once the basic ailment is addressed, the diabetes normally tends to go away. One should be aware of a condition called pre-diabetes. Pre-diabetics are not diabetics but have a tendency to develop diabetes if it is untreated or unchecked. Pre-diabetics are people who have an increased blood glucose level, fasting or otherwise, and they, if untreated, progress to actual diabetes. Progress to actual diabetes is not automatic. At this particular level, if addressed adequately, may not develop diabetes at all. What are the kind of measures one can take as a pre-diabetic? They can modify their lifestyle, they can reduce their weight loss, they can go ahead and make nutritional corrections, they can increase their physical activity and make sure that all these parameters are addressed adequately so that they protect themselves with diabetic disease at a later date.